As if COVID weren't bad enough, now comes the flu.
Flu cases on the rise across the state. It's our top story on Newswatch 16 at 6. Good evening, I'm Scott Schaefer.
And I'm Lisa Washington. We are still at the beginning of flu season, but the state says there are more than 8,000 cases of influenza, already more than all of last year.
Newswatch 16's Carmela Mataloni live for us tonight at Lehigh Valley Hospital, Pocono. Carmela.
Hi, good evening, Scott and Lisa. Last year, the flu barely showed up in the state of Pennsylvania, leaving us with the lowest cases on record. This year, certainly not the case. Doctors here at Lehigh Valley Hospital Pocono tell us they are keeping a watchful eye on influenza, especially as we continue to battle COVID-19. Flu cases are on the rise in the Keystone State. Doctors at Lehigh Valley Hospital Pocono in East Stroudsburg tell us there are more than 100 confirmed cases here in Monroe County.
This year, we are already seeing a surge of influenza. Looks like type A is the most predominant type that we're seeing. And it started early this year, even for a regular year, even without COVID. A lot of times we don't usually see it until January, February, but it's already started hitting several weeks ago.
We are still at the beginning of flu season, and the state is up to more than 8,000 confirmed cases of influenza. Last year, there were only 3,600 confirmed cases throughout the entire flu season. Looking at the data for our viewing area, there are already around 1,000 cases of the flu around here. Dr. Jonathan Goldner says COVID-19 related safety measures like working and schooling remotely, mask wearing, and social distancing helped keep flu numbers down last year. Another possible reason for the increase in flu, doctors say vaccination numbers are down this year too.
I think a lot of people are just tired of getting vaccinated, perhaps. I really don't know. We're not seeing the robust numbers that we had been seeing with people coming in for a flu vaccine.
Spotting the difference between flu and COVID is also tricky, so doctors suggest getting tested.
COVID can mimic flu, and flu mimics COVID. They're both viruses, so it's really difficult. They both have a lot of the same symptoms. They could be similar to like cold-like symptoms, but also there's some GI stuff like nausea and vomiting, sometimes some diarrhea with the flu, but we also see that with COVID as well. And usually what we tell our practitioners, if you're going to test for COVID, test for flu.
And doctors tell us to buckle up because flu season goes through May here in Pennsylvania. Carmela Mataloni, Newswatch 16, reporting live here in East Stroudsburg.